Can patients with psychosis go to work? Work maintains people's participation in society. Even though patients may encounter difficulties in finding a job, we should encourage patients to overcome difficulties and lead a fruitful life. People with a history of mental disorder may experience the following difficulties when looking for a job. Patients with more working experience may think that their current job is low paid and less respected compared to their previous ones. What can caregivers do? Family members and friends should listen to the patient's job expectations and plans and provide opinions and encouragement. Some patients, especially those with higher education, may think the salary and job nature do not meet their standards. If the expectation is too high, family members and friends can discuss with them how to adjust their expectations for work. Some patients may be unable to account for the gap year. Some may feel reluctant to reveal to employers that they suffered from psychosis. Caregivers should discuss with the patient how to strike a balance between privacy and needs in mental health before deciding whether to reveal to the employers the illness history. Teenagers who lack working experience have not gained enough self-knowledge, interview skills, working experience, and knowledge of the employment market, and therefore they may give up easily. Many non-governmental organizations offer career counseling and vocational training. Also, caregivers can help establish short-term and long-term goals which are realistic and concrete. Short-term goals include improving the personal resume, sending 3 cover letters each month, and completing a certificate course within half a year. Long-term goals include successfully finding a job and persisting with that job for at least a year. Establish reasonable goals in concerted effort to help patients work towards their goals. Returning to work may bring pressure to patients. Psychosis may have undermined the patient's confidence. Caregivers should encourage the patient to appreciate their own strengths, meanwhile to keep up with their skills and training as well. They should encourage patients to talk over their problems. For example, the side effects of medication leads to tiredness and difficulty in concentrating. Caregivers can also encourage patients to participate in voluntary services or part-time work so that they can polish up their social skills, bolster confidence, develop personal interests, and enhance coping skills in order to find better jobs in the future. However, caregivers should understand that everyone's path is different. While some may want a prestigious job, others may just wish for a stable job which can provide them with satisfaction. Under the influence of some symptoms, patients may not be ready for work, such as those who show a lack of motivation and interest in life. Despite these psychotic symptoms, caregivers may misattribute patients' behaviors to their personalities and attitudes, misjudging them that they are lazy and eager to improve themselves or make changes. In fact, it is unwise to urge them to return to work under these conditions, as undue pressure may hamper recovery.